just want you to imagine if I gave you a couple of hours back in your day. What would that mean for you? Over the next 5 minutes as I speak, I want you to think about that. My name is Gunjan, and I'm the founder of Astra Health. And before I get into the solution, I will begin briefly by sharing with you the inception of Astra Health. So working closely with many doctors over a significant period of time, we observed that there's a crisis in primary care. Workforce shortages, costs that are skyrocketing, and hours spent on administrative tasks, especially note-taking, that results in feelings of burnout and job dissatisfaction. Now, to alleviate these challenges, we co-built Astra Health with clinicians, and we've kept these important aspects in mind. Number one, patient data safety, ease of use, customization to your unique preferences, and the ability to have the same efficiency with consults conducted in other languages in addition to English. Because look around you, we live in such a diverse community. Now, Astra Health is an English and multilingual assistant that generates structured clinical notes and other documentation within seconds from your consultations. We have up to 35 languages available that you can speak in with your patients, and the notes will be translated into English. Now, usually for demos, I demonstrate in English, but here I'd love to show you a consult in Mandarin. So I'll just play that. So you can just begin by selecting your language and start the consult. As soon as that red dot starts flashing, you'll see the consultation being transcribed in real time. So no audio files are being recorded here. So in terms of getting consent from your patient, it's very secure and reliable as well. And it cuts out all the chit-chat and the AI generates structured clinical notes from that consultation and translates that into English for you. And from here, you can generate other documentation as well, like referral letters, medical certificates, and then you can also, for this particular consult, it actually turned into a mental health consult, so you can select from the preset templates and generate your notes again, and which is ready for you to review and finalize. Now, you can also do quick hands-free edits using your voice, and we understand the critical importance of patient data security, which has been one of our top priorities when we've designed this platform. It complies with the Australian Privacy Act, and we maintain the highest standards of data protection. You may have noticed no patient details were entered during this demo video. And for whatever reason, if your patient did mention any personally identifiable information, it will automatically be redacted and replaced with an asterisk, so no personal information is ever stored. Now, this demo was sped up, but imagine if this was your consult, whether it was in English or another language, how much time that would have saved you. Now, based on feedback from doctors that are currently using Astra Health, we've observed some benefits. So many report saving more than 2 hours daily. They also report saying that during their consult, they're more present, they're not focused on making notes and sort of doing other things, and they're able to finish their administrative tasks more quickly, so they can either finish early or see more patients. And they can also, it's more about the continuity of care. The documentation is also improved quality. Now, enough from me. I'd love for you to hear from one of our users and a GP back in Sydney.
Astra AI has helped us a lot. When the patient comes, you're really focusing, you're looking at the patient, eye contact, you're listening to everything, you are making your calculations and your assumptions and examination and summing everything up to the patient, and you didn't have to write anything. By the time the consultation is finished, you've diagnosed the patient, you've done the treatment, and you just finalize, and it's all been written for you in point form. I'd say an average of 10 hours. So Astra Health has been helping me to finish on time so I can get home and have dinner with my family, which is something we've missed on for a long time.
Now, if you were to start saving an extra 10 hours a week like Dr. Maha, what would that mean for you? What would that mean for your own personal well-being, for the people around you, your team, and ultimately your patient's experience. And if you were to see more patients, the financial gain for you. Come and visit me at stand 18 to learn more. I'd love to have a chat. And you can sign up for free today. It only takes 2 minutes, and you can see for yourself the benefits like Dr. Maha has experienced. Thank you.